Welcome to Blizzard Fire. We hope this video helps fire up your solution.
You start by preparing the skin correctly. Wash with a gentle cleanser, rinse with lukewarm water, and pat dry. Once done, wait 2 to 3 minutes so the surface is just damp, not wet. Take a pea-sized amount of acne medication 5 and dot it across the affected zones, then gently spread in thin, even layers, do not rub hard. Make sure to avoid eyes, nostrils, and lips. This timing and amount limit irritation, while delivering effective active ingredient to follicles. Once you've mastered the first application, build a safe routine. Start using acne medication 5 once nightly for the first 2 weeks to assess tolerance. If no excess dryness or irritation appears, progress to morning and night. Make sure to wait 1 to 2 minutes after the product absorbs before applying a non-comedogenic moisturizer. This reduces flaking. In the morning, always pair with SPF 30 or higher because the treatment increases sun sensitivity. Also, do not layer other strong actives at the same time. To finish the process, monitor progress and be patient. You should expect gradual improvement over 4 to 12 weeks, so track changes weekly. If you get persistent irritation, intense redness, burning, or peeling, stop use for 48 hours, then resume every other night. Make sure to reintegrate moisturizer. If severe reactions occur, or you see no meaningful response after 12 weeks, contact a dermatologist for adjustment or alternative therapy. One troubleshooting tip: when mild irritation happens, reduce frequency before.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.